Good afternoon, everyone. Thank you to those who had a very quick lunch and have come for this very interesting session that we have for the first time in our ARM. This session is introduction by the HOIs of Vidyavihar, Ayurvihar, and Sameerwadi. They will give us an idea of the research that they are continuing. And as everyone knows, research is not only about having patience and perseverance, but good research comes from a very good collaboration, a very good discussion between colleagues and elsewhere. Keeping this in mind, we thought, why not invite our own neighbors and to this session of the ARM. Keeping this in mind, it is my pleasure to invite you, sir, to chair the session. If you don't mind, sir. Inviting Professor Shivgaonkar, our provost, to chair the session. The session is 10 minutes per director and dean. The bell will ring at 9 minutes, and then you are given 1 minute and 1 minute for discussion. Requesting you to kindly stick to this. Our first speaker is Dr. Vivek Sonapwar from the KJ Somaiya Institute of Technology.
Thank you. Honorable Provost, Dr. Raghunath Shivgaonkar sir, who is chairing this session, and the August gathering of faculty, research guides, and research scholars. It's indeed a great and proud privilege to be speaking before such a August gathering. So actually, it's a challenging session post lunch. Okay, so more challenging for me. Okay, and I thought it would be a working lunch, but when I found it was a sumptuous lunch, so it is very difficult, but I will try to cover things in a very short span of time. So at KJ Somaiya Institute of Technology, Mumbai, Sion, we are Ayurvihar campus. So basically our thrust areas of research and development, we are working in AI, machine learning, image processing, computer vision, data science, Internet of Things, space science, GIS, nano, climate science and technology, technology applications for agricultural, healthcare, and those 2 points which you see at the last, because see, that is mostly belonging to mechanical engineering, from where I come from, and we are in minority there. So only 2 areas you'll find. Rest is KJSIT. To people it means Institute of Information Technology or computer allied things. So mostly those areas are predominant. As far as the research summary is concerned, this is for last 3 years we are presenting. So almost 1,600 publications, some conference publications, books, chapters. We are around 22 patents, out of which 14 are granted, copyrights, and major collaborations. We have 34 faculty who have completed their PhD. So, we have one postgraduate program in artificial intelligence, which has been now a very prominent area, and Government of India, All India Council for Technical Education has declared coming year as a year of artificial intelligence. So we have PhD centers in 3 areas, that is IT, computer and electronics and telecommunications. Now as far as major projects which are coming under research and consultancy, so design of satellites, I'll come to that later where we have a great achievement. Kisan Khajana mobile application with Godavari biorefineries. Then geofencing of farm plots, weather-based electricity load forecasting using AI-powered heat wave watch and early prediction, and so on. So we are working in these areas as well as in the healthcare also. So as far as our major achievements, on 1st of January of 2024, Somaiya Beliefs at Zero, developed by our own team under the guidance of Dr. Umesh Shinde, who is present in the audience. It was launched with PSLV C58, and it successfully completed 6 months in orbit before decommissioning, and it was working properly. Then amateur wireless station we have, which is a licensed one. Recently we have received a grant of 50 lakhs from AICT for drones. Okay, so we are commencing that work. Initial inspection and other things have already been completed. Then IIC, that is Institutions Innovation Council. So we are doing, for last 6 years, we are top performing institute. Then 15 odd need-based ICT solutions. Then our students are doing well and winning prizes. We have awards and recognitions to our faculty members as well. Then as far as our future vision is concerned, we want to take our satellite venture further. And in coming 5 years, mostly we would like to have series of satellites, ham payload, then development of GPS-based LED pico satellite and all that. So in coming 5 years, you'll find more and more Somaiya satellites in the orbit. Then drone technology, as I mentioned, Internet of Things and cloud computing, 6G communication. One of our faculty members is nominated as an expert in technical evaluation committee for 6G proposals by Department of Telecommunication and under Ministry of Communication. Then AI and IoT in manufacturing, cloud manufacturing, logistics and supply chain, and heat transfer. So I think I have kept my timing of 10 minutes. So thank you one and all. And basically I'm thankful to Dr. Santosh Narayan Khedkar for his initiative, so that I think we can synergize amongst all institutions and, you know, get benefited, wherein faculty can collaborate, research scholars, laboratories can be utilized in a better manner, and we can have that robust culture of research and development. So I think, thank you sir, thank you Anand.
Are there any questions to sir?
Nanotechnology, I think I had some work in nano coating of ceramic components. We'll take it further. I think that will require a lot of laboratories and the other facilities as far as, but I particularly worked with an industry wherein we have alumina commercial products which are used in chemical industries and all. We tried to coat with nanoparticles and investigated physical changes in physical and chemical properties. So we got some good results and we have patented that particular. But nano, I think we have mentioned, but as of now, we require much more work.
That's why I asked, because we can collaborate there.
Yes, definitely.
Your faculty or facilities, what you have.
And we have plans on cards to start with chemical engineering as envisaged by our Honorable Chairman and Chancellor. is keen to start chemical engineering. So I think with chemical engineering we can
That
do.
will be great combination.
Yes, lot of.
Thank you, sir.
Thank you. Any other? I think I invite you, all of you, to, I think, visit our Ayurvihar campus so that you can see what we have done, and then we can have more discussion. Thank you. Thank you.
Thank you so much, sir. We have our next speaker, Dr. Kishan Pawar from the KJ Somaiya College of Arts and Commerce.
Okay. Good afternoon. Respected Professor, dear friends. It's my proud privilege to share our contribution to research during last year and a few years even ago. Actually, I joined the institution on first November 2024. I'm sorry, 23. And it's been just just more than 1 year. So I'll more focus on last 1 year only, 1 or so. Immediately after coming, and Professor also insisted, and he told me specially that we have to have a robust research policy. And since we belong to the aided institutions, to imbibe research culture among the teachers is a separate job in itself. And we are trying our best to contribute to that. And here is what I have to share. Before this, I just have to share one more thing, that we had consecutively 2 A's of NAC accreditation before. And this cycle also we got A grade. So this is 3rd cycle consecutively. The first one was B+. And we are now into the 5th one, and we are already preparing for that accordingly, whatever the plans have been given. So we have PhD research centers, government recognized, university recognized in these 5 departments: Commerce, Hindi, English, History, and Gujarati. And we have a number of guides in our college, 10, and applying more. And to add to that, economics department's LIC has taken place 2 days before, and they have successfully given the reports also. And we shall be getting the confirmation of the research center in economics, aided section of course, maybe in coming 1 month time. But that is what I wanted to share this off the record, because it has not yet come. So I have not put that there. But then I'm very sure that in coming 2 months time, we shall be having 6 PhD research centers, including economics. We have presently 10 research guides, and the teachers with PhD in my college are 32 out of 42 working teachers in the college. So, and the remaining, of course, almost all of them are pursuing their PhD. And the researchers who are doing research are 19 presently. We had conducted a research conference on 4th January and February. This is a research workshop that we have, quantitative and qualitative and quantitative research methodology on 4th January to 4th February. It is still continuing. And we have invited the research, PhD researchers, MPhil researchers, and MA students for this. And we have called the resource persons across the institutions. We had organized a research conference on 31st August 2024. That was after my joining to the college, and that was on the journey of India from her ancientry to Viksit Bharat, keeping our future 2047 in mind, and it was a wonderful conference. Then we also have had another conference on unveiling role of women in the Indian knowledge system, and that was on 9th March 2024. And we have also a conference this year on Shanta Shelke, the Marathi poetess, on Vyakti and Sahitya on 17th August 2024. That was conducted by Marathi department. Presently, we have 7 research projects. Minor are 6 and 1 is major. And they are the grants is received already from government and non-governmental agencies for research projects. And we have also a research seed funding of our college, of our own college. And it's around 22 lakh rupees. And we give maximum 25,000 rupees to each research projects. We publish books under this. We give the money to the research paper publications and organizing conferences as well. And we are supporting the teachers also with this. We have the publications for last 5 years. Research papers in UGC care journals and peer reviewed are 147, which is, I know, a very less number. And that is where exactly sir told me to increase the number, and we are trying our best. We can only motivate the teachers to do research. We cannot make it compulsory, because research is something that happens, I think, with the belief and trust and faith in the ideas that one has in the area. We have books and the book chapters, 49 in number. And that's all. Next year, I should share my plan. Next year also, we will be having one conference that is international under the English department. And that will be an interdisciplinary conference, especially on translation. Apart from this, my idea was, I have not mentioned here because it has not yet come. The other thing is that we are starting the research journal of our college, and that will be in humanities. And I just have talked to sir also that we can have a interdisciplinary journal of the university also, where the teachers will have their own journal to share their research papers. Because when the research paper is ready, it's a Herculean task to find out an authentic journal. You know, if we have our own qualitative and best journal available at this distance, that will be a great thing. And I think we can discuss that also regarding this. So thank you very much, sir, having invited me here. I may have some questions if there are, please. Thank you. Thank you, sir. That's all. Thank you very much.
Thank you, sir. Our next session is going to be shared between Dr. Usha Naik and Dr. Sheetal Pujari. They are representing KJ Somaiya Medical College and Research. Dr. Sameer Joshi is unable to attend. May I request Dr. Usha Naik and Dr. Sheetal Pujari to kindly come on stage. Just a minute.
Good afternoon, all. Myself, Dr. Sheetal Pujari. I am the HOD of the Dermat Department in Somaiya Medical College, and I head the research cell. And Dr. Usha Nayak, she is the head of the Pharmac Department in our medical college, and she also heads the Institutional Ethics Committee. So we will be presenting on behalf of Dr. Sameer Joshi, sir, our Dean, sir. So these are the institutional committees which are required for research in a medical college. So we have the Research Advisory Committee, the Board of Research Cells. The research cell is basically for the multidisciplinary and the collaborative projects. The Institutional Scientific Committee and the Institutional Ethics Committee, academic as well as clinical trials ethics committees are different because we deal with human subjects. And Institutional Animal Ethics Committee. So these are the research projects, a summary of past 4 to 5 years. Some of them are by the faculty, some of them are by the students, and some of them are by the postgraduate student research, because we have MD in various subjects, MD, MS in various subjects, as well as DNB. So we have a lot of postgraduate student research as well. So these are the department-wise research projects. I'm not going to go into the details. I'll just, you can see that many of them are hospital-based research projects. Some of them will be community-based. So these are the department-wise research projects. So all of us have at least 5 to 6 running projects at a time. This is we have a specific center, advanced center for oncology. So a lot of studies on hemophilia and other rare diseases are, there are several research projects being conducted by this center. Coming to the clinical trials research unit, Usha will be talking about this.
So good afternoon all, good afternoon respected sir, thank you. So we have a clinical trials research unit, and at the moment we have 18 ongoing clinical trials. Most of them are concerned with the hematology, and we also have a collaborative trial with the Ayurveda department. The drug it's being researched jointly by the psychiatry and the Ayurveda department. So there are 18 ongoing clinical trials. Dr. Savita Rangarajan is in charge of the clinical trial unit, and the hematology laboratory there is run by Dr. Srimati Shetty. It's a very up-to-date laboratory and has very high-end investigations. Coming to the publications and books for the last academic year, we have 18 research publications, 2 books by 2 heads of department, and chapters in 6 books. These are the research grants that have been awarded or received in the last 1 year. So the first 4 grants are to the hematology, the Accord department, and they're from both international and national agencies. There were 2 other grants that were received from Somaiya Vidyavihar itself. So one is to the physiology department, and they're proceeding with their project this academic year, and one was in the last academic year that was granted to the Center of Advanced Neurosciences under Dr. Abida Shah. Regarding patents, they're actually with Dr. Sheetal's department. One has been granted, the Department of Dermatology, and one is in the process, has been filed already. This is Sir's vision, so we wish to enhance collaborative, multicentric, multidisciplinary research across all fields of medicine, as well as all the institutes here at Somaiya Vidyavihar. So thank you very much for the opportunity.
Of our research methodology, we have primary survey that we do. Most of the journals these days I see whenever I submit my research paper, etc. So at that time, they require ethical clearance statement for that. So could
you mentioned one word regarding which projects you said?
No, whatever research paper I try to submit to any Scopus Index journal, let's say. So for these humanities research also, they ask for ethical clearance certificate.
Basically, any patient-based research would require ethics committee.
No, it is
human-based.
Yeah, the human base, the normal
I think
primary survey.
Usha would be able to better answer because she heads the ethics committee.
Yeah, I would also like to know the procedure, how to get that from the college.
Just to answer your question, and maybe other students also would probably help them. So it obviously goes through a review procedure in your institution, and the technical thing gets handled over there. But most good publications will ask you for an ethical approval, and it has to go through this thing for human studies. One thing that sometimes we miss out is even a questionnaire-based study, because that is also an intervention. So we should not believe that intervention is only a surgical or a medical intervention. Even a simple questionnaire that is sent out is an intervention, and it will require ethical approval. So it's most likely that you will be asked by a good publication for a ethics certificate. So we have the committee for academic proposals. So you're most welcome to submit it to us, and I will leave the email ID of the ethics committee, and we will schedule it according to your convenience. And you will also have to submit along with that an IRB or an institutional review board, so we know it's gone through the thing technical, because we won't have that kind of background. So the final ethical approval will be given as required by our committee. Okay, I hope that answers your question.
Yeah. Regarding your cancer-related studies,
yes, sir.
What kind of do you have any kind of single cell imaging technologies or associated work happening in your campus?
So I don't think as of now yet. I'm not really in the position to answer. Right. But as because the submissions come to us, so I don't think we are as of now.
Okay. Yeah. So we have a lot of expertise on visualizing cancer cells and imaging technologies and all that. Just it's open for
So that will be a very welcome collaboration that could happen. Thank you, sir.
So in continuation with Professor Radhakrishnan's question and help, I would like to know two things. One is, which areas you will allow others to come and use the facility of your hospital, like laboratories or other things? And second, which areas you need to collaborate, like artificial intelligence is there, data science is there, so you need some help from our side, university side?
Sir, as far as lab facilities are concerned, they are mainly what we have is diagnostic facilities. So if we are looking at a particular study, like sir mentioned single cell imaging studies, so whether that can be correlated with a pathological study, and that is something which came to my mind immediately when he talked about. And regarding artificial intelligence, yes, we have actually, my department especially has had, I'm from the DOMAT department, we have had nearly 3 projects with Chitra Bhole from the IT college. Yeah. So we are looking at that because AI is coming up big in healthcare. So
AI was an example, like the science department.
Yeah.
Biotechnology is there.
Yes. Immediately what could come to my mind was whether any genomic studies, gene studies, that is what we are lacking at.
So answer is not required immediately. You can go and think, and then we can have a meeting. So that
basic sciences, yes, sir. That definitely, measurement of toxins or anything from the science department, if we can do, that will definitely be welcome. As of now, we have had AI-based projects with the IT college. So that has been good. In fact, the patent was there with jointly with the IT college itself. That was about before COVID actually.
School of Management is there, which can be doing something with the...
Okay, sir. We can think over. Yes, sir. Thank you so much, sir. Thank you, sir.
Thank you so much, ma'am. Our next speaker is Professor Shweta Manvadkar from KJ Somaiya College of Physiotherapy.
No problem. Yeah, hello. Good afternoon, sir. Good afternoon to all the eminent people present here. So, this is about the KJ Somaiya College of Physiotherapy and the research that happens there. Myself, Professor Shweta Manvadkar. Overall research, I would say, mostly in the field of physiotherapy is happening quantitative, and now the trend is going towards mixed because a lot of our research involves quality of life, because there's a lot of dysfunction that goes with any ailment. So a lot of research is now tipping into mixed, and purely qualitative is also happening. We have 4 departments. So the thrust areas are in musculoskeletal, we work mainly for reduction of pain, improvement of function. So what works better in which areas? In neuro, we have a gate lab now. So pediatric, adult neuro rehab, cardiorespiratory, we have onco rehab. So a lot of rehab work and research around it is being planned and already happening. Also, wound management is one area, so a lot of research around diabetes, metabolic syndrome, that is being taken by students as well as faculty. Community department is working for geriatric, women's health, persons with disability, ergonomics. Our institute is relatively smaller compared to whatever the other institute that just spoke. We are a total 33 teachers. We have BPT, MPT, and PhD. And total number of faculty, as I said, 33. PG guides, out of them are 14. And PhD guides are 3. Only 2 PhD are so far completed, and 19 are pursuing PhD. Total number of students are UG 100, PG 24, PhD 6. These are the number of faculty per department, total 33. Total number of publications I have kept as for 5 years. In last, this 1 year, we have in index journals 7 publications, and we are geared to increase that number. Number of interdisciplinary courses, interdisciplinary research is to be increased also. Currently, we have collaboration with the College of Engineering and medical college, a lot of data collection that our students do, but apart from that, faculty is also doing research with medical college in hemophilia, and sports academy and St. Xavier's Gate Lab, where our students are posted. Faculty is doing one research there, also in Kikabai SRM hospital. So this is what currently the neuro team is working with the engineering department. So there are 2 researches that is going on. One is a sit to stand chair for stroke patients who have difficulty in getting up unassisted. So this is one which is even patent application is done and it's in process. The sensors are ready, the other project, and they are now to be tested in our gate lab. This was one successful product that came out of our collaboration with engineering students, and 2 of our faculty and their students collaborated, and we came up with this exergaming robo rehab device. So it has gamifications, and patients can be given challenges, and their upper limb and lower limb function can be improved. Currently, validity and reliability testing of this machine is being conducted. Our students are going for Avishkar participation since last 3 years. I think the participation has increased, and we have been able to get the students selected to represent the university. But so far, the students haven't won the inter-university round. Our IEC is also registered. We have had so far 1 online conference, and now we are hosting another conference on 21st and 22nd of February in collaboration with Riddle. So the theme of it is innovation and beyond. So the speakers are quite a diverse range of expertise. We have one of our faculty has filed 2 patents, design patents, and with her husband, who is also a physiotherapist. Rest of the faculty are working on their patent filing. There are 5 copyrights so far, 3 already received, 2 are applied for, The received ones, the one is on clinical vignettes for patients. The second copyright is a ICU checklist for teaching students. Two of our faculty have a book chapter in obs-gynec physiotherapy. We had applied for MHS research grant. The process was too lengthy. We received the grant. It was a very nominal amount, received the approval. But the students had gone by that time. So this was not a very successful experience. So you're working on higher and better ways of working on the research grant process. We have collaborated with Medical College for Hemophilia. One of our faculty presented 2 papers working with the hemophilia team. She was sponsored the registration fee for the conference, which was waived off for her. And in Spain, she had presented 2 papers. These are the equipments that we have. So sports collaborate with us for isokinetic. We have Balance Master. The GATE lab is coming up. EMG NCV is there. In cardiorespiratory, we have PFT and Tanita, which is a fat analysis machine. In innovation cell was inaugurated, under which students had presented their innovation products, and one of it was selected again at Avishkar to represent the university. So in future, we feel that my teachers are managing the clinical and teaching plus research. So time seems a challenge for many, but as is our requirement and as is the interest of the teachers, we are geared to work in all these areas. So more publications, grants, copyrights, patents. So everything we need to, we feel, increase in quantity as well as quality. So there I see a possibility of collaboration, because now we are mainly collaborating with engineering. So if there is any other possibility that we all can, my teachers also can think of, because IT is one where we felt that we definitely can collaborate. So there are some activities geared towards it. And we are also going to have in our OPDs for data collection, sir also had suggested, we still have manual data entry. So for that we are collaborating with IT. So those things are in the pipeline. Thank you. Thank you. Any questions? So normally we have simple terms. If we have a weighing machine, it gives only the weight. Or we have height and weight, and we have BMI. But this fat analysis has multiple factors, multiple parameters. So it can tell you actually the body fat. So it can separate the protein and the fat and the weight. So components, so we have fitness classes. So on a regular basis, every, I guess, 3 monthly, we check how much is the change after they have done our fitness class. No, we have it. But research happens on that. Thank you.
Madam, just I wanted to know, how do you handle the cases of frozen shoulder? Are you looking for any alternative therapy like cell therapy?
Alternative therapy like?
Cell therapy.
We have not ventured apart from physiotherapy. We haven't done any testing on any other pathy. So for frozen shoulder, so far we have manual therapy, which is our mobilization, or we have our electrotherapy, which are our equipments. We also have, for strengthening, we have different equipments. So we have pain relief, which is required in frozen shoulder. We have therapy for increasing the range and increasing the strength.
It takes a lot of time and it becomes painful for the patient.
Frozen shoulder has a very typical behavior. So first the pain is at the highest, then stiffness starts, and then everything goes on the decline. And that is the time when we can work the maximum. So initially we have to reduce the pain first.
I have done some cases with cell therapy, maybe around 40, and I assure them relief in 24 hours, complete relief with stem cells.
They were in which phase of frozen shoulder? Was it the earlier, or the stiffness had already developed? Even with stiffness?
Yes.
Because in stiffness they develop capsular tightness, so which has to be broken.
So then the cartilage and nerve points with the sensitive points,
okay,
they get stabilized.
Now this can be researched then together.
Secondly, I want to know what do you do for wound healing, that you mentioned about wound healing.
So for wound healing also we have electrical modalities. So we have laser, IR, UVR. So even there, we check the size of the wound, and after giving electrotherapy, again, then the wound size is measured.
That the current which will go in the micromoles?
Everything will have a different denomination. So laser again has different classes. So the class 4 laser will be for wound healing, if I remember right.
Yes, correct. So I thought you must have been having either hyperbaric oxygen chamber.
Hyperbaric, it's what we have seen is it's a bit controversial. So some claim it heals, some claim that it doesn't.
Okay. Especially diabetic foot injury.
Yes.
And cases of amputation.
We have seen excellent results with, if it's infected, UVR gives excellent results, or laser. And if when it's healing, IR gives good results, infrared.
There we can collaborate in these two only.
Sure,
with
sir.
The science department in the university.
Sure, sir. Thank you. Thanks for all the questions. Thank you, sir.
Thank you, ma'am. May I request Professor Avni Oak from KJ Somaiya College of Nursing to please come up.
Good afternoon, everyone, and thanks a lot for giving us this opportunity to present what we are doing at the research. Thanks, Dr. Shivgaonkar, for chairing this session. As a nursing institute, we usually are regarded as listening or as assistant to doctors. And we are a fairly, what can you say? I can say we are preschoolers in terms of research, because we are now initiating research, but I will say that in spite of being a very young institute, we are trying to do what best we can. Overall research which is going on in the field of nursing is emphasis on the evidence-based practice, where we try to see what are the results on the patient care, where we usually as nurses want to see their comfort level, the quality of life, and the patient safety and the infection prevention. So these are the major aims that we aim for, and the evidence related to the various techniques is being carried out. Preventive health is given more importance, and nowadays there are also various innovations for the care that we give for the patients, which is coming up in a big way. The emphasis is now on non-communicable diseases, like how can we see to it that we change the lifestyle, what kind of a diet, if it is given, is more effective to prevent certain diseases, and stress on the chronic illness and enhancing the quality of life. The thrust areas that as an institute various researches have happened are mostly pertaining to health and nutrition. The clinical research in terms of making various checklists and seeing to it that, like maybe how can we reduce the time for transfer outs, or how can we see that we give the handing and taking over of patients more effectively. So such clinical researches which improves the patient care are being carried out. Stress and health. We are also trying to see interventional and interdisciplinary research, and we have completed certain projects by preparing certain formulae for wound healing, like aloe vera gel for episiotomy care, or making a massage oil for arthritis patients. And these are the certain examples that I can give where we have tried to do interdisciplinary research. We have also done research on bundles, like when the patient is supposed on a ventilator. What kind of interventions together, if a nurse performs, will reduce the complications related to ventilators? Or if a person is having intravenous lines, how can we reduce the infection and the thrombophlebitis? So we are trying to create bundles of care to improve the care. There are lots of researches which are being done on the education innovation, like how can we make simulations better, or OSCE, what kind of OSCE, if it is done, can improve the students' performance. So competitive the interventions or competitive studies are being taken up. There are certain management studies like which we had taken to see what kind of job performance standards are required, or what is the job satisfaction, what is the competitive levels of our students. So such kind of management studies have been taken. In creating a research culture in our institute, so we have a research policy wherein we encourage the teachers to do research, and also the students are being encouraged to present their papers in various conferences. We also have faculty development programs where we have initiated the symposiums and conferences on how to write research grants, or how to see that they present and prepare a research proposal. Another thing that we started last year was we celebrate Innovation Day, where every class prepares some equipments or prepares certain innovations and present it. And we had a very good, what can you say, the participation was very, very encouraging, and we are trying to see whether we can take these innovations which are there as copyrights and patents. We have also initiated compulsory attendance in Avishkar and publications for PG students. We have resources which have now been available for our faculty and students. And conference registration and participation in research papers is now encouraged through giving certain funds or seeing to it that we encourage them and give some time for them for the research. In short, till now, the research publications are 66, but we had to start a culture. So though the number 66 seems very big for a small institute, these all were peer-reviewed journals. And the Scopus indexed articles are till now 8. There have been 5 books which have been published by my faculty and 5 copyrights. Till now we have not achieved any grant as such, but we got some aid from companies like Arjo Huntley, Yogi Krupa, wherein we were able to use the equipment to see and do patient care studies. We have total, sorry, the number is missing, so the total UG GNM projects we have completed is 60. BSc projects which we have completed in the last 5 years is 25. And there are 5 PG projects which have been completed. And at present, there are 4 GNM, that is diploma projects which are going on, and 11 postgraduate projects which are going on. These are certain awards that have been received for research by the faculty. So at state level, the faculty have received 8 awards and 21 at the national level and 3 at the international. And students have received 5 awards at the state level. In the future, what we aim is applications for research grant and seed funding, working towards patents and copyrights, increasing our Scopus publications, and using research and evidence as a routine in teaching learning process so that the students know what is happening and their knowledge is up to date, and initiating and encouraging the innovations. So this is our future that we feel we should do as a nursing profession to see that we uphold and go forward in our careers. Thank you. Any questions? Thank you.
Thank you so much, ma'am. May I request Dr. Nandakumar Kunche from KJ Somaiya Institute for Applied Agricultural Research to please come on stage.
Good afternoon, respected professor, all dignitaries and research scholars, faculties, dear friends. So my institute is like, it's a little bit different. All the presentations I saw, it's academic mostly. So we are into agriculture. So that is our background. So a little bit I wanted to brief about the institute and what are our priorities areas. Rather than, I'm sorry, actually all the academic data is missing because I was not knowing like all those things has to be presented here. Although we have good academic data also, like publications and some books, all those things. But here I'll brief about what activities we are at present going on and what areas we are interested in working, and maybe from the audience, if anybody is willing to collaborate and work with us, so those areas will be open to discuss. So our institute is established in 1971. Before Godavari biorefinery is established in Sameerwadi, that is in Karnataka. It comes in Bagalkot district, but we are having 2 districts on the border. This factory is there. So before that factory installation, our institute has been installed because for that area, there was very limited knowledge available for sugarcane growing in those regions. So that's why our SK Somaiya, so he was the founder for this institute with the mandate for sustainable development of the farming community. And we are working in mostly all the technologies and interventions which are required for enhancing the productivity as well as the farmers' economy. That is our main mandate. So we address 2 sustainable goal development mandates, that is climate action as well as good health and well-being. So these 2 things are addressed through our agricultural sustainability. And then going to the technologies, like being a farmer, implementing community is a farmer. So here a lot of difficulty will be there, like applying the technologies. So if you see in earlier days, all were like very traditional systems were there in India, and now we are in the phase in between, like technology is there, but for implementation there are lots of limitations are there. So farmers are still in confusion. So only some upper layer is engaged in technology applications. It is very long way to reach all the farmers or to engage with these all technologies. But still it is a need of the day. So what our KJ Somaiya Institute is doing to address these issues. So value addition, we are trying to work out with the adding new varieties for our local site specific, or we can say climate specific. Now, our zone is called as peninsular zone. So there we work for the varietal evaluation along with the Government of India, that is ICR, where we are voluntary center, approved center for all India coordinated trials for sugarcane. So that is our one of the core area, where every year we evaluate more than 20-25 varieties, and we recommend out of that which variety is good, suitable for our region. So accordingly, the Sugarcane Breeding Institute will take the decision for launching this or commercializing this variety. And then we are working for soil health, which is major concern. Then intervening with the tools and technologies which are suitable for mechanization. Digital monitoring we started recently. One project is we are working with the NABARD bank. And then biological research, which is very important. Soil microbiology is very important for any yield enhancement or the quality of the produce is mainly dependent on the soil microbes. So that area we are focusing. Then demonstration for the farmers. So these are some of the varieties which we recommended in last 5 years, which are commercialized. The yellow color highlighted ones are from our center, which were having the data in brief. And then we work for the quality planting material supply through our tissue culture laboratory. So 3-tier system is there. So where we bring the quality material which is approved by the Sugarcane Breeding Institute, which is viral free. It is tested by the accredited institutes, and then we multiply these and give to the farmers. Then we work for the soil health, which is very important. So now we have launched already the concept of regenerative agriculture, where Professor Larry from Michigan State University, he is very much leading this program through Cascade, and our Somaiya, who is chairman of our institute, is very much interested in eco-friendly systems to be applied for the farming community, which can give the good health, good quality of the produce. So here, this is just to give the idea like how the India is affected by climate change, and where our district is also affected. Almost in Karnataka state, 70% of our districts are affected. And this is another vulnerable picture where organic carbon is going down, which is the major limiting factor for enhancing any yield or whatever input we are giving, like fertilizers, the plant can uptake only if the organic carbon is good. So that is the major limitation. So in Karnataka, in our state, the percentage of the organic carbon which is in the range of 0.25 to 0.5, that is very, very low. So it should be minimum 1.5 or at least more than 1. So there we have to work on the long-term basis. We are working. So these are some data which we generated in our laboratory. So where we targeted 2,000 farmers and 100 villages in our captive area. So here, whatever you can see in the blue, dark blue color, only those are the areas which are fertile. Otherwise, everything is non-fertile. So here it becomes very big challenge to have a good productivity. So some microbiological interventions we are doing, identifying good microbes which can help for improving the uptake of the nutrition. So those two products we are working with, like nitrogen uptaking bacteria, that is Azotobacter and Azospirillum, and then for phosphorus solubilizing also we have some bacteria which we are producing in a large scale and providing to the farmers. We are also monitoring some digital farm system where we can have a monitoring and inform to the give the advisory to the farmers. So what is going on, like nutrition lacking is there or water stress is there. So accordingly, this is the project which we are working with NABARD Bank since last 3 years. Now almost we are at the end, and now we are launching new programs for more effective trades. And one more crop we introduced recently, that is sugar beet, which is again a biofuel crop. So which is last year we introduced, and we are working on these areas for developing good quality ethanol from the sugar beet, apart from the sugar cane, because sugar cane is having limitation now, and government also wanted more to be used for sugar, not for the ethanol. So there other crops are also important. The like way, again, energy cane is also one more important crop which we have collaborated with the Brazil Institute. So we have bought some new varieties, and we are trying to adapt those varieties for our biofuel program. And then our initiatives are towards regenerative, as I mentioned in the earlier. So how we work in the different areas, like precision farming is again IoT based, and AI machine learning applications are there. So already we have initiated some collaboration with College of Engineering, and we are trying to develop some groups who can work practically how we can enhance these areas for our local farmers. Of course, there are some publications, but they are very limited. We have to work localized way. So that's why we are trying to work out with university groups. Like other area like trash management, remote sensing is also one of the area. AI in agriculture is having big scope. Already some good publications, good projects are running, which have been proved also successful. But reaching to the farmers is big difficulty. We have to work on the cost-effective methods. So where again students can take part in like developing some customized modules where for the localized problem, addressing the problems. So right now in developed countries like USA and Europe, so a lot of mechanization is done, but that is not suitable for our country. So where we have to develop our own methods. Already some work started, maybe hardly 1% of the farmers will be using those things. Now we have to propagate those into different quantity. So in digital agriculture, the focus areas are real-time data collection is important, and Internet of Things we can use for monitoring the irrigations, fertigations. IoT-based we can do, mobile-based applications are already there, but again usage is very difficult, so there we can intervene. Sensor-based applications we are working out. Right now we are working with one Dutch organization, and project is also funded by the Dutch government. So where we are working on groundwater monitoring. So where in summer scarcity is there, so how we can budget the water like whole the year. When rainy season is there, they are using more water, and then in summer they are having problems. So that how we can monitor based on the sensors we are working in that area. Drones for spraying and other things already started working on it. And carbon is very important, like carbon footprint. Sequestration is important, and emission, avoiding emission also is important. So there we have some programs initiated now. And our focus areas are digitization of the farm boundaries, which is already working with KJSIT College. Dr. Shamal is our collaborative partner. We have done 55,000 of the plots boundaries we have done. Our 2,80,000 is our target. Then crop diversification we are encouraging to the farmers. Organic amendments are also intervening. Carbon footprint, again, this is not yet started. Maybe some people are interested from university, some faculties, we can work on those areas. So again, this is the area of our interest where specific. This is one course we started with College of Engineering, MTech in Digital Agriculture, or we can say this agriculture science and technology specifically. Digital agriculture world is not approved by AICTP. Yeah, so these are our collaborative partners. This is final slide. So we are working with ICR, SBI Coimbatore, and NABARD Bank, Water Mappers. Okay, thank you. So we are working, one of the thing I missed with in telling is we are global alliance with Michigan State University of USA, having collaboration with Egerton University of Kenya. So where all three partners are working for the same purpose. So 5 areas we defined and where we are having collaborative programs. The major areas are biofuel, bioenergy we can say, water stewardship, and then soil health, precision agriculture. So these are the areas of interest. And we are also working with, as I said, water mappers, which is the exactly ground level program is there. And other government institute, we have university collaborations to release the varieties, other things. And this is one of the information I just wanted to pass on already. We are discussing this part. So recently we had our Global Alliance meeting in Sameerwadi, where our Sameerji was also available, present and participated in this meeting. From Michigan State University, they offered 2 grants for us, like $25,000 each in these 5 areas what I discussed now. And equal grant we are also putting from SUV, that is already committed, but formalities has to be completed, and once it is approved officially, then SUV faculties are open to work with Michigan State University, where we can also be part of it, KIAR, so that we can address the problems what we are looking for in digital agriculture field or soil health. These are our 2 interests. If anybody is coming up, already we have floated the intent. So this is our small research group at KIAR. So thank you. If any questions are there, I would be happy to address. Thank you so much. Thank you so much. Yeah, please. Right. Yeah, animals is like a, that is an integrated approach. Yeah, it has to be done, but the problem is like labor issues are coming up because government is also encouraging, but very limited people are addressing those in that approach.
So this is the real solution,
right?
And replacing that with any kind of fertilizer or any cooked up product is next to impossible. So that is the only unique solution, as our conventional wisdom also suggests. And
that is there.
Just a comment.
We are also working on the regenerative approaches. We mean for that only, like using more biologicals, reducing the chemicals. That is our purpose. Thank you so much. Thanks.
Wait a minute. So I would like to thank you, Dr. Nandkumar. I can see the love for your research. You have come all the way 500 kilometers traveling to give a presentation of 10 minutes. So we really appreciate, and a loud applause.
Thank you so much for giving opportunity. That is also important. And we are here for like collaborating with more faculties and divisions where time is short. Otherwise, we would have discussed in topic wise, but maybe next time we can discuss individually.
Detailed one. We can have
because microbiome is one of the major area where that is becoming a very big limitation, and there are no innovative tools and equipments to identify those enhancements. Only market is booming, but there are no results in the farm. So there we have to address. So maybe I just open that topic. Anybody is interested, then we can work together. Yes. Please.
Just a minute.
Yeah, sure. Yeah, basically, number one problem is organic carbon maintaining. So that is very difficult. So right now there are different interventions we are trying, like biochar application, but that is again having some limitations. Which quality of soil needs which quality of biochar? That is one. Another way, crop rotation is very important, which is missing now. And then intercropping for green manuring is also another approach. So integrated approach is required. It is not like one solution can be given, and enhancing the biologicals and reducing the chemicals. That is the only way to enhance the quality of soil. And water usage is also another big factor, because where water is available, there uncontrolled water is being used. So salinity and sodicity is being increased. So that has to be. Yes, biotech side recently, if you see, from one of the University of America. They developed one microbe with genome editing for this. It is able to take the nitrogen from the air. So that is like innovative approach. Biotech plays very big role in different ways, like for the enhancing the traits, identifying the new bacteria, and analyzing those. So many biotech is also integral part of agriculture, where already GM we are not allowed in India, but that also played a very big role. Yeah, thank you, sir.
She has already asked it already, okay. So we'll talk later.
Yeah, a lot of scope is there. We can work together. Thank you so much. Yeah.
Thank you so much, sir, for coming and giving us this insightful session. Our last speaker for the session is Dr. Pratnya Prabhu from KJ Somaiya College of Science and Commerce.
Yes. Very good afternoon to each and everyone, and thank you for inviting us for this presentation. The first slide is about our college. Should I? Yeah, thank you. So I won't be able to see it anyway. We are accredited by NAC with A grade in 4 continuous cycles. The Best College Award in 2010 long back, autonomous status from 2012, and recently we received empowered autonomy status by University of Mumbai. Fees grant by DST in 2013, which was 90 lakhs, and 2014 and 17 we also got DBT Star DBT grant for all 11 science department, which are around 2 crores, and which really help us because they give the grant only for the undergraduate studies. So because of that, we could definitely improve our laboratory equipments and the requirements. College with potential for excellence in 2016 and 2024 ISO 9001-2015 certification. Not about the research, but definitely Honorary Prime Minister Narendra Modi ji during his Mann Ki Baat program, he had appreciated our NSS students, an outstanding college award by Somaiya Vidyavihar on Founders Day. This is about the research awards. I have just highlighted a few. In all the photographs, we have Dr. Rohit Singh Chauhan. He has been awarded. And he had total 41, would like to say something about him. Total 41 Scopus research publications, 1 book chapter, 2 review, and 1 prospective, again in Scopus. And grant of 13 lakhs, DST SERB, already it has been completed. I-10 index is 17, total citations 550, and H index 13. So he's actually our, we should say, research star of our college. For research promotion, we have a well-written research policy. We have research monitoring committee as per, of course, UGC guidelines, and research advisory committee where the students of research students, they present their public, the work with the PhD students. These are a few facilities which we have, resource subscriptions for the library. And we conduct many research strengthening programs, like we have structural coursework for research scholars. We are offering the coursework to other colleges as well. It is an online course, 4-credit course on research methodology, research ethics, central instrumentation facility. We have the central instrumentation facility, and till now we have conducted the workshop for around more than 100 students, outsiders as well as our own students. And we also offer 1-credit course on molecular docking and drug discovery. This is our research infrastructure. We have central instrumentation facility where we have GC, gas chromatography, HPLC, HPTLC, of course UV visible spectrophotometer and other all instruments being the science college. Plant tissue culture lab, even if we are not maintaining the proper standards because we have very small space, it is not possible, but UG level research can be done, some small projects can be carried out. Soil sieve shaker in our and rock cutting machine in geology lab and a fermenter in microbiology lab. Thrust area of research, this is actually the thrust area of all the teachers because almost all the teachers of our college are PhD and NET or SET cleared. Very few, maybe 3 to 4 teachers who are in the verge of retirement, we should say. They are not PhD, otherwise almost more than 95% teachers are PhD. So this is the research area where synthetic organic chemistry is mainly most of the teachers work in organic chemistry, catalysis, green chemistry, polymer chemistry, etc. In geology, climatic reconstructions. In zoology, mainly biodiversity, ecology, entomology, animal physiology, toxicology, microbiology, applied microbiology, biosurfactants, environmental biomicrobiology, bioremediation, botany, plant biotechnology, phytochemistry and all, physics, laser material interaction, computational physics, etc. These are the thrust area of all the teachers. Under best practices, we conduct learn from stalwarts every year. So we invite the stalwarts. You can just see the list. I'm not going to read. So we invite from various institutes and the students can interact with them. And they are with us for maybe sometimes 2 to 3 days. So it's a good opportunity for the students. This is data for the last accreditation cycle, almost 5 years. And in this, we had minor research grants of 11 lakhs. These are the University of Mumbai minor research grants. And the major research grants of 60 lakhs. Recently, these are the total grants. The TARE grants for 2. IC SSR grant 11 lakhs to this. She is business law teacher. Jyoti Sharma is from geology, Afsar Ali from chemistry, and Dr. Rohit, he had DST SCRB, and he is also from chemistry. Under research development, we have 140 research publications, out of that 90 Scopus and 50 UGC or other index research publications. 74 number includes everything, books chapter, conference proceedings, etc., presentations. And we have various MOUs and collaborations. Consultancy, we have the consultancy with few departments. Microbiology, we are doing water sampling and soil analysis. Botany, we are doing degradation of bagasse. This is again for Godavari Biorefinery. Biochemistry also, assessing the quality of milk at Nareshwadi. Zoology, biodiversity assessment of SL word. And geology, noble gas structure, and chemistry, we are doing wastewater analysis and so on. Mathematics department also, we don't have PG, but we have UG, 2.37 lakhs of grant for National Center of Mathematics. So overall data is in chemistry, we have 14 research guides, and now we have 41 students who are doing PhD. 4 MSc by research. Actually, we don't get MSc by research students nowadays because MSc by papers admissions are very easy, and therefore it's very difficult. In microbiology, we have only 1 research guide because most of the teachers are retired now. We have actually 89 sanctioned seats, and out of that we have only 53 teachers now. So those who are the guides have retired, and now we have applied for the new teachers, and some of them have got the research guideship. In zoology also we have 2, one in entomology, and the other one is in oceanography. So 4 PhD students, botany 2 research guides, biochemistry 3. We don't have PhD in biochemistry, only MSc by research. And geology, recently she got the guideship. So there are 2 guides in geology. Already we have a contribution to intra-campus synergy, we say, because our students go to Sameerwadi KR to do the internship. So 6 microbiology students have completed internship, 4 PG. This is recent data, otherwise every year we send the students. Godavari Refinery also the students do the internship. We are doing water sample analysis for Nareshwadi Eklavya Sports Complex also. MOU with CIRAC, and recently 2 of our students who did microbiology MSc in our college, they are doing PhD under Dr. Parvati, and they have already left for Michigan State University, and they'll be there for 4 months, 2 students. 2nd February, yes. So internship, on-job training, Riddle. Particularly, we were facing the problem for our commerce students to get the internship. And so we have a very good collaboration with Riddle, and they are really helping us for doing the internship and on-job training. monitoring that, we have actually one MOU with Earthwatch India team, Delhi, and we are working with Experiential Learning Center of Somaiya. So these are the collaborations which already have, but I will say it is definitely as the basic sciences and undergraduate and postgraduate students. In addition to that, I have already mentioned about Riddle, BioRiddle. Eklavya Sports Academy, actually our microbiology department, they are also studying the microbial parameters of swimming pool water and also the equipments which are used. So they are collecting the swabs continuously, they go there and they are doing the analysis. That is something which is new, and the sports complex, they were very happy about this. These are various functional MOUs which we have. Recently, we did the revival of biogas plant, and our microbiology department are doing the projects, small projects at PG and UG level. NEP implementation, I will not go into details, but we have on-job training as well as the field projects, and these are some list of field projects. Internship of the student, these are basically of the students, but also the teachers are involved. So 70 publications in research journals and conference proceedings by students, 8 startups and 3 patents by the students. Participation in Avishkar, I will just talk about this year for academic year for 24-25. We submitted 24 projects. At zonal level, we had 5 winners, then 3 winners at final round at university level, 1 gold and 2 bronze, and participation at state level 1, who is PhD student. So future vision is, we have just mentioned here, advanced materials for energy storage, what we look at actually for the collaboration. So development of metal organic frameworks, MOFs and COPs also for battery or supercapacitor applications. Use of solid state chemistry to design stable recyclable material. Functional materials for water purification. I have noted down some points after discussing with the teachers. And biodegradable materials for medical applications. So after listening to our other principles, I just thought we can definitely have, already we have, but we can enhance with IT college. Because we also have the GIS lab, we are offering the course on certificate course on GIS. So we have GIS lab, so science and climate, science and technology, agricultural technology, data science, microbiology can definitely do more work with KR. Synthesis of novel molecules, actually we are working on anti-cancer activities also of the novel molecules, but we could not go ahead of the testing because of the limited facilities. We did primary work on cell lines, but we would definitely like to go ahead. So this is what we wish for, and thank you so much for giving this opportunity. Thank you.
Thank you so much, ma'am. With this, we come to the end of this session. I thank the speakers, and I also thank you, sir. Sorry, I have to ask you to come and sum up the session.
Okay, thank you. So first of all, let me thank Dean Academics and Research, Dr. Santosh Narayan Khedkar, for inviting to chair this special session. The other session which I attended yesterday, there individual research was presented. Here, the institutions are presenting their research. Indeed, it is a very privileged session. I would like to thank all the speakers who made a very good presentation. A lot of research is going on in various institutions. But that research is going only in islands. What we want it should really percolate to every possible level in every institution. So there is a excellence which is there is a research which is there, but we have to really enhance that research culture in the institutions. That is the one. What is the objective of this kind of seminars or this kind of presentations? First and foremost is, I think it's a stock taking exercise. When you make a presentation to somebody, you take a stock, what you did. Many times you keep doing a lot of things, you are yourself keep forgetting it, not aware of it. But when you prepare yourself for a presentation, you really consolidate it. And that gives you a good perspective of what you have done. At the same time, it also tells you what more we can do probably in our system. So first, it is a stock-taking exercise. That is the purpose of this. Second, if you listen to the other institutions and what the activities which are going on, it really encourages for the interdisciplinary research. And today, research cannot be done in isolation with the individual departments or schools. We require a lot of problems which are cut across the different disciplines and departments. So through this kind of seminars, we come to know each other's activities, their research, what work is going on there, and people can come up with a proposal which could be of joint nature and which can be very well funded by the SPU. Dean will definitely encourage those kind of activities. So interdisciplinary research is another outcome of this kind of presentation. Third one is a competitive spirit. If I see that Sonapwar has 1,600 publications, I'm sure others will start thinking, if not 1,600, at least I should have 160 publications. At least there is some competitive spirit will come. So knowing what others are doing, people may get motivated. They may get really encouraged. And that is another objective, essentially, for this kind of seminars. So as I said, essentially it is not the individual isolated research, but we have to create a research culture in each and every institution. That's what is the primary objective of this kind of seminar. Just a suggestion, if you want to really do that and take a stock taking, why do we want to take a stock only once a year? Within an institution, why can't we take a stock every week, every 15 days, every month? And one of the simplest way to do that is, I think all the institutions typically have about 30-40 faculty members in the institution. I want to propose that let each faculty make a presentation of what work he or she has done in last 6 months. In every week, that presentation should be done by one faculty. And every faculty should attend it. Every faculty's turn is going to come after about 8 or 9 months. 33 faculties, if you put, about 8-9 months you will require to really come there. At least in 8 or 9 months, you should have something to tell. And if you don't have anything to tell, then itself will speak for yourself. So you don't have to ask anybody else. You yourself will decide, now in 6 months, I don't have anything to tell. I should do something really more. So that is another thing. So please start this activity of faculty research seminars within your institutions, where faculty will come and tell what kind of research they have done. And it can be attended by all postgraduate students, faculty, even the undergraduate students if they want, they should be able to come and do that. Finally, when we do this research, most of the time we boast ourselves that we have published so many papers and so on and so on. What we need to do is we have to do the benchmarking. What are your peer institutions? Where do they stand? What are you vis-a-vis them? So can you define the standard for yourself? When I say, I have published 100 papers, can you say which are your standard journal which you think where you should be publishing? Can you publish that in advance? That my target is I'm going to publish research in these kind of journals. I'm going to go to IEEE journals, ACM journals, and so on and so on. So every college should really define their own list of journals, which will be the target journal where they would like to publish. And then work towards publishing in them. It will not happen overnight. It will take time. But if you and when you publish something, don't publish directly at a journal where it will be accepted immediately. Start from a journal where you know it is going to be rejected. But the rejection will tell you the comments which will tell you what is missing in your work, where you can really advance, and then you can submit to the next level journals and so on and so on. So by doing this iterative process, slowly, automatically the research level will go up, the quality will go up, the research level will go up, and you will get much more visibility actually in this. So this seminar essentially is going to serve all these purposes which I told you. So next year, when we meet, I think we should have addressed some of these issues, and come up with a much better model for our research in our institution. So once again, best wishes to you, and thank you so much again for doing a wonderful presentation. Thank you.
Thank you, sir.
Thank you, sir. I request Dr. Vaidande, Dr. Vivek Sanapwar, Dr. Prabhu and Dr. Nandakumar to kindly come on stage and hand over Professor Shiv Gaonkar, a small token of our appreciation. So she's coming.
This is the faculty publication. Already we have published last year 23, whatever faculty publication of Somaiya Vidyavihar University. Yesterday we published January 21 to December 22 abstract. Now this is the 24 faculty publication of the Somaiya Vidyavihar University. We want to release this today in this session.
Take it from him. It's very heavy. May I now request Professor Karandikar to kindly come on stage. Thank you, sir. Thank you. Professor Karandikar, I request you to please give Professor Shiv Gaonkar a small token of appreciation from the ARM team. Thank you, Professor Shiv Gaonkar, for your time and your comments. Thank you, sir.